Hey, future nurses, do not let antidepressants get you chewing on your pen tip during the exam and looking out the window. So come closer, let me simplify it for you. And I also have NCLEX review on antidepressants, mental health disorders, and antipsychotic NCLEX review on my YouTube channel at Scrub and Spoon, so go review that. Now, we are going to be talking about 3 types of antidepressants: the SSRIs, the TCAs, and the MAOIs. The first one we talk about is SSRI, selective serotonin reuptake inhibitors. SSRIs are used for depression, anxiety, eating disorders, and OCDs, right? And what is the mechanism of action? SSRI, as the name implies, they stop the quick absorption of serotonin in the brain. Think about serotonin as the feel-good chemical. Your patient needs to have this feel-good chemical in the brain to have a good mood, to have less anxiety, less depression. So SSRI inhibits the fast absorption of serotonin that have to be in the brain for them to feel good, right? That means more serotonin in the brain, less depression, less anxiety for your patient, good mood for your patients, okay? Now, SSRI medications are medications ending in suffix like talopram, ozotine, zodone. The only one that doesn't have a suffix and you just have to commit to memory is sertraline, okay? Now, for side effects, SSRI can cause low libido, late ejaculation, okay? And for SSRI, it is taken in the morning. Remember, SSRI taken in the sunrise. That would help you to remember. Now, the NCLEX tip you sign up for with SSRI, never you mix SSRI with St. John wort. It is always on NCLEX. You never mix it together. Why? Because combining SSRI with St. John wort, and St. John wort also have serotonergic effects. So if you combine these two together, it's gonna cause serotonin syndrome. Remember I said serotonin is feel-good chemical. So combining two will be too much serotonin in the brain, and this will cause agitation, restlessness, and tachycardia. These are the signs and symptoms of serotonin syndrome. So remember in your NCLEX, when you combine SSRI with St. John wort, what will it give you? Serotonin syndrome, right? And never mix SSRI with alcohol because it causes sedation. So you don't want to mix it with alcohol that also suppresses the central nervous system, okay? Also remember, if your patients have been on SSRI and they need to change to another type of antidepressant, maybe because it's no longer working for them, there is always 14 days wait period before starting any other or another type of antidepressant to avoid serotonin syndrome still, okay? And like I've mentioned earlier, it takes up to 2 to 4 weeks before you start seeing antidepressants therapeutic effect. Now let's go into TCAs, meaning tricyclic antidepressants, right? They are older antidepressants. They are used for depression, anxiety, chronic neuropathic pain, right? And what is the mechanism of action? TCAs work by inhibiting the fast absorption, reuptake of 2 things. Remember with TCAs, 2 things: serotonin and norepinephrine. Like I said, feel-good energy, feel-good chemicals. So they slow the absorption or the uptake, the fast absorption of the uptake of these 2 chemicals in the brain. And when there is good level or enough level of serotonin and norepinephrine in the brain, your patient feel less anxiety, less depression, good mood, okay? And for TCAs, there are medications ending in tryptyline, like amitriptyline, pramine, and the last one doesn't have a suffix, so you have to commit it to memory, which is amlodipine, okay? Now, when your patient is taking TCAs, remember this, it causes dizziness. So always encourage your patient to change position slowly. And it can also lead to orthostatic hypotension. And what is orthostatic hypotension? Is sudden drop of the blood pressure while standing up. So if you are trying to get your patient up and they say, I feel dizzy, while on TCAs, let them sit back or lie down, okay? That will help. Another NCLEX tip you sign up for is, remember, TCAs always cause anticholinergic effect. And when I say anticholinergic effect, there is a mnemonic for you to remember. Anticholinergic effect means they dry up the body, right? Remember, can see, can spit, can pee, can't poo. Meaning TCAs causes blurry vision, can see. They causes dry mouth, can spit. They causes urine retention, can pee. And they cause constipation, can poop, right? And if your patient is on TCAs, you can help them with dry mouth by giving them more fluids, hydration, right? And for the constipation, you can encourage more eating of vegetables, fruits, and fiber, okay? And with also TCAs, it takes up to 2 to 4 weeks before therapeutic effect, and there's also 14 days wait period before starting any other antidepressant. You have to wait, okay? Now, let's go to the final one, the MAOIs. MAOIs meaning monoamine oxidase inhibitors. And MAOIs are used for anxiety, depression, PTSD, right? What is the mechanism of action? They also inhibit the reuptake of 3 things. See how we came from gradual 1 thing, 2 things, 3 things. They inhibit the reuptake of 3 chemicals: the serotonin, norepinephrine, and dopamine. So these antidepressants, even though they are powerful antidepressants and they are like the last resort, like if every other antidepressant doesn't work, then they try this last one, which is the MAOIs, right? So they block the reuptake of the feel-good chemicals: serotonin, norepinephrine, and dopamine, okay? Now, for MAOIs, the medication doesn't have any suffix, but if you write them out, you're gonna spell tip. So I'm gonna put it on the screen. You see the names of the medication under MAOIs, okay? Now, let me give you the NCLEX tip you sign up for under MAOIs. When your patient is taking MAOIs, they are always on tyramine restricted diets. What does this mean? It means they cannot eat fermented food. Why? Because if they are on MAOIs and they take fermented food, it will cause hypertensive crisis. That is, they will have hypertension, increased blood pressure. And that is why when they are on MAOI, they will tell them never to eat food like fermented cheese, like old wine, like yogurt, like cream cheese, right? Like crawled meat and liver. They will tell them not to eat all of this, because if they eat all this that contains tyramine, it will cause tyramine-induced hypertension. And also, like I said, when your patient is taking MAOIs, also there's always 14 days waiting period before starting any other types of antidepressant, right? And MAOIs are always taken in the morning too, and it takes up to 2 to 4 weeks before you start seeing a therapeutic effect. Let me give you 2 nursing considerations you need to know about all antidepressants. First, never stop antidepressants abruptly. In fact, any medication, never stop them abruptly, that is suddenly, because it causes, stopping suddenly causes exacerbation, that is worsening of the condition you are using that medication for, okay? The next one, which is one of the NCLEX tips you sign up for, is when your patient is on antidepressants, monitor for signs of suicidal ideation or suicidal thought. Why? Because now that they are on antidepressants, even though it takes up to 2 to 4 weeks before you see the therapeutic effect of antidepressants, but it gives them energy between the first few weeks of taking it, and now they have the energy to carry out their suicidal plan. And that's when monitor for statements like, I feel better now, I want to give out my property, because they feel like they're about to end it all. They need to share their property. So monitor for that. Now, let me give you signs and symptoms of tyramine-induced hypertensive crisis or tyramine-induced hypertension. First, severe headache, stiff neck, nausea and vomiting, tachycardia, high blood pressure, which is the main thing, increase of their blood pressure, and also chest pain, right? And signs and symptoms of serotonin syndrome that I've mentioned earlier are agitation, restlessness, confusion, tachycardia, sweating, high blood pressure, hyperreflexia. Okay, guys, I hope I have been able to simplify antidepressant for you guys, and when you see it in your exam, you are gonna ace it. Bye.